Hey there. Well, I'm back, and it is October 16th. Let me see. I had my operation on June 14th, 2013, and it's October 16th. So, let me see. July, August, September, October, 4 months. 4 months. And, by the way, these are my little puppies. Turn around. Look. Look. This is Chopper. This is Chopper right here. And this is Momo. We do Momo. Momo and Chopper both are spoiled, and they love their daddy. Anyway, just wanted to. I can't talk with y'all talking with y'all looking at me. Anyway, this is a update. This is an update to everyone to let you know that I am down to about 220 pounds. I started off at 280, and then I had my surgery date was June 14th, and I had my 2-week liver shrink that I did, and the liver shrink was I dropped down from 270 or 275. It was 275. I dropped down from that to 266 on the day of surgery, and the day of surgery, it was when it was 266.5 actually. And I've done one video since then. It was like a week post-op, week and a half post-op, something like that. But anyway, all right, time for y'all boys to get down. Time for y'all to get down. I wanted to say that I've had some troubles, and I've had some good times. The troubles is I've had a little bit of indigestion since I had my surgery. Never had a problem with indigestion. Never had a problem with acid reflux. And they say that if you have acid reflux, that usually after the surgery you don't have it anymore. Well, I think it reversed it on me. I have a little bit of indigestion from time to time. I'm saying the past 4 months I've probably had indigestion maybe 3 times. Not real bad, but I knew I had it. And I have only vomited once, and that was bad. That was like 3 weeks after I had my surgery. I had to order a greasy French fries. I should have known better. Real small order, but from McDonald's. Go figure. Of course, as soon as I ate them, within 10 minutes, I gave them back up. So, learn my lesson that no greasy food. I don't know. I should be following my doctor's orders, but we all try our own, try to cheat, stuff like that. But I learned my lesson. But anyway, the next time is I had a real small lunch. I had steak and baked potato, something like that. It only took like 3 bites of steak and a couple bites of baked potato. But at that point, drinking sweet tea, about a quarter of a glass. For some reason, that lunch, I almost gave it up. But I didn't. I sat around for a minute, and I thought I was going to have to make myself throw up. I've never done that, but I was at the point where I was miserable. I was hurting. I couldn't breathe hardly. So after I got in my car, I moved around the corner and was preparing myself to throw up, make myself throw up. And I didn't, just like that, it went away. But up to that point, I thought I was dying. I almost felt like I was dying, but just eating too much. What I wanted to do is say that it actually teaches you, even though the doctors say, "Oh, you're not supposed to do this." Well, you learn the hard way, actually. A lot of times, that's the way I learned best, not that it's the easy way, but anyway, I learned not to eat fast. I learned not to eat too much. I've been kind of eating almost whatever I want. I do lay off a lot of the fried foods, I try to lay off of those. I try to eat, more grilled fish if I can. I do eat cheeseburgers, and I do eat pizza, and I do eat other crap, and I think what's helping me lose the weight is, of course, the surgery, but at this point, I'm not eating a whole lot. I'm eating maybe a piece of pizza at a sitting, and then come back 2 hours later and maybe eat another piece of pizza or eat a few potato chips or something, just not eating a whole lot of it. So I'm still losing weight, but I am now down to 220. I've actually started recently looking in the mirror, and I've noticed that I've got excess skin. And I had a big chin before. I mean, it was a real big neck. Basically, it looked like I didn't have a neck. But and my arms were pretty big. I've been stocky all my life. But now I am actually look like skin and bones without a shirt on. Well, I'm not gonna pull my shirt off because I'm kind of a little bit embarrassed. But anyway, I'll stand up and I'll show you my arms, and I'll pull my shirt up, kind of show you my stomach a little bit. So anyway, if you want to see how big I was, you can go back and look and compare the pictures. You can see the first video. I had a good sized gut on me. My gut stuck out in front of me a good 3 inches, and now I'm wearing size 38 pants where I was wearing size 42 and 44. 38 pants I'm having to wear with a belt a little bit, so maybe another month or so, a couple months, I might be down in size 36. But I'm loving that. And my shirts are size XL. I'm loving that too. I was in a 3X and 4X shirt. So I'm able to tuck my shirt in. I've got a lot of compliments. So I'm feeling really, really good about myself. So, but anyway, here's my arms. My arms, I have lots of tattoos. Thing is my arm used to be like this, and not saying that it was fat. It was muscle and stuff. Well, now this is what I'm looking at right here. All this. I don't like that, but I'll have to start working out and doing something, in the gym to get that fixed. But anyway, here's my gut. It's flabby. Hangs over my belt just a hair, but I will say that my gut used to stick out at least to about right here, and now it doesn't. I'm fairly flat-chested now. As you can see, it's almost, flat. But I feel really good. I mean, my shoulders, they used to be a lot bigger, broader, because I was, had a lot of weight up here on my chest. But now, I mean, I can feel my bones, all across here. I mean, I've got bones sticking out and excess skin, and it's not gross, but it's to the point. It's more than I wanted. But I'm 220 pounds, and my goal is 200 pounds. So I think I'm making progress. Let me see if anybody's got any questions out there for me. Feel free to ask me, and I get my email. My email, it emails me every time somebody sends a comment or anything. So if you have any questions or anything, just let me know. Dr. Virginia Weaver was my doctor in Memphis at the St. Francis Hospital, and she is amazing. She is her and the other doctor that works with her is they're good. They're really good. But I think Dr. Weaver has a big heart, and she loves what she does, and she loves it because not that it's good money in it and all. I'm sure that's one plus thing, but the fact that she's able to help so many people turn their lives around, and they come back to her after they lost all this weight, and they're doing so much better. They're healthier. They run. They do all kind of stuff they couldn't do before. I will say that things that I'm off of my blood pressure medicine. Not taking that. I had a little bit of. They started me on it right before I had my surgery. I'm off of that. I no longer have sleep apnea. I do not snore. I think maybe a couple mornings I woke up and had a little bit of dry mouth, but for the most part, for the past 3 months, I have not been snoring. My wife says she loves it that I'm not snoring. I wake up, I feel like I'm refreshed. I do get a good night's sleep now. I still have problems with my lower back, but that's not. I don't think that's weight. I think it's related to my bed that I've got. But anyway, I do feel a little bit healthier. I've been trying to take my vitamins. I haven't been taking my calcium citrate like I'm supposed to. Did buy some, but I haven't been taking it. So I've got to start taking that. Got to get back into these shakes again, start getting a little more protein, and then get back in the gym. But anyway, thanks for watching, and if you have any questions, let me know. And You know, I used to have a big fat chin. I still got a little bit now. You know, it's nothing like it was. I look a lot skinnier than I was, so I'm really happy. But anyway, there you have it. Thanks.